So a different way to start a meeting, and you can use that in the meetings that you lead. It engages people in a very different way. So that was one of 33 liberating structures that have been gathered together by my good friend and colleague Keith McCandless, who runs the Social Invention Group. And so I invite you to explore this website because this Wordle represents all of the different liberating structures, which are new ways to engage people in conversation, new ways to engage people in creative thinking, new ways to tap innovation, and new ways to improve quality. And so we are going to use these to kind of structure our day, and I would invite you to explore that Liberating Structures website because they're free for the taking. There's a Creative Commons license there, and he's got a great setup in terms of explanations about how to do the liberating structures, what you need, how to, what some of the parameters are, and how you can do variations on a theme in regards to that. So this is our agenda for the day with some of these liberating structures. I know some people probably want a big picture view of where we're going today and how we're going to get there. So we've just engaged in impromptu speed networking. Our next event is going to be a thought leader interview where I will have an opportunity to engage Jos in a conversation and an interview and find out a little bit about him and how he got interested in what it is that he does, the good, the bad, and the ugly. The thrill of victory, the agony of defeat, and he'll share with us a little bit about his experiences over time. And then you will have an opportunity to engage in another liberating structure called 1-2-4 all. And basically this is an opportunity to generate a question for Jos. And this liberating structure, the structure and the process is that you will generate a question that you want to ask him. But then you will share that question with another person in a dyad, a two, and then that dyad will share a question with two other people, four, so that we'll get iterations and developmental patterns in relationship to the question. And then that group will be able to then ask Jos the question. So it's another form of integration. And then we have something called a user's fishbowl experience. And so actually there was a cadre of nurses that went over to Amsterdam in January to learn and immerse themselves in the Buurtzorg model. And they are going to share their experiences with us. And we're going to eavesdrop on that conversation while they are in the middle of a fishbowl. And then there will be an opportunity then for the group to ask questions of them. And then as we kind of go through the day, we will talk more about what really happened here and what now and what's next in terms of action steps as we sort of close the morning and engage in culling the wisdom in terms of getting feedback and information from groups. So I do know that the Rochester folks are there and the St. Cloud folks are there. We want to constantly engage you. And also, when we get to a point about asking questions from the audience, Andrea, where's Andrea, is our microphone runner. We do need to get your voice on microphone in order to capture it in terms of the dialogue. So that is the structure for the day. And now, Jos, come on up, as they say. Where are you most comfortable? Right or left?
Left.
Left. Okay. All right. And they suggested that we need to look this way at the camera.
So if I don't look at you, it's not because I think you're not
right, but
worth to look at.
It's the audience there.
Okay. Thank you.
So welcome. I know you've been here a while this week, and so a lot of people know about you. Mary Jo did a fabulous introduction, but I wonder if you could just share with us a little bit about how you got interested in this innovation and what prompted you to kind of do something different in terms of the work that you do and the activities you're engaged in.
Yes, thank you. When I was 18, I started study economics because I was interested in how you could use money for doing good things. But after 2 years of this study, I noticed that it was not about doing good things with the money, but earning as much as possible money. So I started, I was quite depressed. It was my first depression when I was 20. And I started to work as a nurse because I did some work when I was 16 in a hospital. And I thought, okay, that looks like a nice job to me. And then I think I found my future in this job I had in the hospital. And I worked for 5 years in hospital care. And then I did a bachelor education. And then I became a community nurse. And then becoming a community nurse was, for me, was the feeling this fits me the best. And I worked together with some colleagues in a small team where the autonomy was very big, and we could decide about everything we thought was necessary to arrange everything for our patients in our neighborhoods. And it was 1987 till 1994. And then we had in Holland, we had the dark period about, was for nursing a very bad period, because we got this merging organizations growing with a lot of structures, management layers, and bureaucracy. And the role of the community nurse and the role of nurses become quite small and quite pressed under the pressure of these organizational structures. So then I became a manager director of 2 home care organizations, and I saw every year that it became worse. And I was director innovations. So I was responsible for finding new ways to improve. But everything what I suggested, my colleagues and my board said, oh no, that's not possible. Oh no. No, because that costs too much money, or we can't control it, or other reasons. So after, but I at the same time, I thought I need to understand their motives, and I need to understand how it works in this organization, because when I left as a community nurse in 1994, I said to my colleagues, I only will be satisfied when we have our real role back again. So that was in my head all the time when I was doing these things, and every time I was a very optimistic person, I still am. But every time I was thinking, every year it's going worse. So, and then I decided in 2005, together with some friends, we have to think about a new way of starting something new. So a new way of organizing, and also a new way how the role of the nurse can be leading in everything we have to do in helping patients, because I think that's what we are for. So that, and then what I learned in this world of organizations was they like to make things very complex. So, and in the system, also a lot of policy people like to make the things very complex. So, but if you make it simple, and I am quite simple, then you can do a lot of things, but you can't do when you think that the world is very complex. So I try to make a very simple model, which was based on the principles in the 80s. And I thought this can be more attractive for nurses. It will be much cheaper, because we were delivering products and production, not helping patients, but delivering activities. So my idea was we can deliver higher quality against lower costs with happier nurses. So that were some very important principles for me. And then I thought I had this network with people I already knew because of my other roles. So I just talked with them. I said, this is my idea, what you think about it? And a lot of people said, okay, I think there should be happening something, and we don't expect it from CEOs. It has to come from the bottom, from patients and nurses. And so that's how it started. Just with 4 nurses, I started working again as a community nurse.
So what did those 4 nurses have in common, do you think? Was there a characteristic about the type of people that they were to kind of engage with you in this innovation?
I think the most important thing was their courage. Because they all decided to resign at the other organization I worked for. And they said, we don't know what the future brings, because there was not anything. So we just had a few family doctors who supported us. And we thought, okay, we trust you. That was the most important thing I heard. And the idea was we're going to do it together, and we're going to show what kind of difference it makes. I have to watch it.
Yes.
The camera.
Rochester, St. Cloud. What kind of pushback did you get from the establishment or the organizations, and how did you deal with that? How did the group deal with the pushback?
Oh, we didn't feel so much from a pushback. A lot of people were curious, and a lot of people said, oh, what a silly group of people. Because if it could happen, somebody already had done it. So the idea was, it can never work, and within a year they will find out that it's too expensive to work with high-skilled nurses, because all the organizations are working with caregivers, lower educated. And so it can be done within the system, because it's the system is too pressing to other directions. So there was not really a big problem in the environment. But some curiosity. And there were even a lot of organizations in the first years who asked me to advise them, because they also said, we have to change our organization, so can you help us? So there wasn't, I had not much trouble with the environment.
So last night at dinner, you were talking about your role as you kind of advanced in the management and director kind of position, but at some point in time you said you went through a little difficult period. The organization went through a difficult period. I wonder if you could share that same story with this group about what that difficult period was, and how that prompted and influenced your thinking about the need to do something different.
Yeah. Yes, personally, I went through a lot of difficult periods, but in this organization, it was, I think, 1995, 96, the CEO decided that we should change the organization radically. But not in a way I think was helping patients, but it was getting a better position in the market. So that was the most important idea. And the change was that the call center should be the heart of the organization. So at the call center there should be made the planning for the nurses, so the nurses didn't need to come anymore to the meetings or the office. So the idea was that we can save a lot of money by making the nurses more productive. The call center should be in the middle of the organization. And we had, I think, 8 consultants helping the organization. And at the end is that they almost ruined the organization. So within 2 years, we almost got bankrupt. So, and then the difficulty was that because of the financial situation, the hours care delivered had to diminish 30% for all the patients, and I think 10% of the nurses had to be fired. So just by the ideas of this, the CEO. So the CEO moved, and then they asked me to become director, because they had, they thought the gap between the management and the nurses had become so big that someone should connect again the management to the teams, to the nurses. So that was my the first time that I thought it's not so difficult. If you are really interested as management in what's going on in the teams and you give the right support, then a lot of things can happen. So, but then I knew that every time in these organizations, you had these periods that some CEO had this idea, and then the whole organization almost get disturbed by this some kind silly ideas, in my opinion.
Mm-hmm.
So this was the first period.
Difficult period.
Yeah.
Yeah. And so how did you recover from that? And what was the upward trajectory after that?
We try to focus again on just the needs of patients, what should be quite normal. So we find new ways to motivate the nurses. We asked the nurses what they need to give the best possible care. We used a new way of assessment because we didn't only want to know what kind of activities had to be done, but also what's the bigger picture when you talk about quality of life. Mm. So it was a very inspiring period. Mm. But after 3 years, we had this financial director, and he had some hobbies, and he invented some new plans, and again happened what happened before. Mm. And then I went to another organization.
Mm. Sometimes you have to leave.
Yes.
Right? In order to make a change.
In my opinion, I couldn't take any responsibility anymore for what's going on. So I said then I'm going to leave. And at the moment in Holland, there is a report about this organization I worked. So this problem started in 1999, and at the moment it's 2013, and now there is a report because in 2007 one of the biggest home care organizations where this became a part from got bankrupt. Mm. And 50 million euros of deficit, and all because of some plans of this governing board, of the CEOs. Mm. And it leads to hundreds, I think thousands of people who got fired, nurses who got fired. So a lot of families got trouble by these decisions. Mm. So but you see, for the long term, they have a very bad effect on a lot of people.
Mm-hmm. So given your experience over time, do you have a personal definition of what innovation is?
A personal definition. I think innovation should be very practical. When I was director of innovations, my board asked me to do things which I thought they were not so important. But they were very important for showing the outside world that something was happening. And I said, that what is happening between the nurse and the patient, even if it's small, that you should try to let it grow and show that that you're able to use it in all different patient situations. So real innovations are based on, in healthcare, are based on how can we improve quality of life, sometimes in a very simple way, but these improvements, they can lead to a very big improvement if you use them in a lot of different situations.
Can you give us an example of that, and referencing a team that's done some work in your...
Yes, I think we have some nice innovations going on now, and it's basically about how do we communicate with patients, and how do we how do we look at what's going on with these patients? Do we focus on what people can't do, or do we focus on what people can do? Do we focus on the problems, or do we focus on the strengths of people? So, and one of the innovations, I even didn't know that it was happening. It was in one of our teams in Amsterdam, and it was the walker race. And I don't know if you have these competitions here, but in Amsterdam they started a competition for elderly people walking behind a walker. And it was this elderly lady, she was 84, and she said to the nurse, she said, there are competitions for everyone, but not for us. So this nurse said, oh, then let's try to start something. And then I noticed that they sent me some mails that I wanted to do something, but I sent this mail, yes, please try to do this, a good idea. And then on a Saturday morning, I was reading the newspaper, and on page 7, there was this big picture with 2 ladies behind a walker. So they had this walker race in Amsterdam, and there were 80 elderly people in one of the parks, and they had different distances from 500 meters to 2 kilometers. And every elderly got a medal. And this same nurse, they also took care of the money. So she went to the city hall, and she went to the health insurance company, and she got 10,000 euros. Said, okay, that's enough, I can make. So now she's arranging this competition all over the country. So we have regional competitions now. and after summer, I think in September, she hired the Olympic Stadium in Amsterdam, so all the buses are coming to Amsterdam, and then but it's also quite symbolic. So it's how you can look at people and how you can invite them to participate, and so. But it's another way of looking also at your profession. You can do a lot of things if you use your creativity and if you just try to do it.
I continue to be amazed at the ripple effect. I think Mary Jo talked about how things go to scale, and that's a great example of how one small thing led to another thing, led to another thing, led to another thing, and the iteration and how it just went to scale. So, do you have some advice or wisdom about influence and using your influence?
Yeah. Yes, I think that what I noticed is that when we got all these politicians and also the Prime Minister visiting us, the strongest element was the authenticity of the nurses. So I think it was in 2007, the Minister of Health came to visit us, and we arranged a round table conversation with the nurses who started in 2007. And they were talking about all these client situations. So they talked about what they did with the patients and why they thought it was better than they did before working at the other organization. So now they said we are able to nurse in a way we think it's the best way. And these are the results we see with the patients. And they told a lot. They gave a lot of examples, and the minister was quite emotional. So I even saw a tear on her cheek. And then I walked afterwards. This was a very almost spiritual meeting, I could say. And afterwards I walked with her to the door of this place. And asked her what you think about it, and said, this is wonderful. This is what it's about. This is what I'm doing it for. And then I say, can I give you a hug? So I took her in my arms, and we kissed each other, and since then we became friends. And this same evening, she wrote on her weblog this whole story about this visit, and it's now 2013, but a lot of people still read it because it was very direct and from her heart. So I think this, and every time she invited me at the ministry, she said, Jos, can you give us some examples? Because our policy people need to know what nursing is about. So I just think talking about the things you are doing and making it not too complex and staying authentic, stay yourself, be yourself.
Yeah. One of the things I admire about you, Jos, is you're very value-driven. You are very value-driven, and you have a North Star that you use as your guidepost. Can you tell us where that came from and what specifically some of those values are?
Yes, I was raised Catholic. So now, when I was 12 years old, I wanted to become a priest. It didn't work out.
It didn't work out.
Because of different reasons. But I think what I learned was that I think it's very important to care and share. So we're not here only for ourselves, but we have a lot of people to take care of. And I also noticed that it gives you a good feeling when you are doing things which helps other people. And as nurses, I think we all know that that's the privilege of our profession, that just by doing things you think are good, you get a lot of good response. So I think that's started and the values I got from my parents. My mother was very optimistic, and she always said, if you have a problem, there are 10 solutions. So, and I think she was right.
If you have a problem, there are 10 solutions. Wow. That was embedded in you at an early age.
So we never had problems at home.
You always generate 10 solutions.
Even when the police was visiting us because my brother had done something terrible. It was, oh, yes, we had a bad evening then, but the next day it was...
a new beginning.
A new beginning, yes.
So I'm curious, you've been here now at several visits to the United States.
Yeah.
And so, and the contrast between what you've created there and the diffusion and the way that you go about it is really different than what's happening here. And so what do you see are the challenges that we face here that you've maybe overcome already in terms of your experience and projects?
Yeah. I think one of the most important things is how to reduce complexity. So you have to deal with different payment systems, and they are influencing the daily work in a very dominant way, I think. So organizations are built on the payment system, and the economical perspective has become very dominant. But that's, I think, what I see in a lot of countries. So, and I think what's very important is how can we find ways to handle it in a way that it's not influencing our nursing activities. So I think because there is enough money in the system, so that's not the problem. But I think how we use the money and what kind of costs we are making influence at the end your work as a nurse. But what I did in Holland is that if we have good nurses who are doing their work every day, they're sharing their knowledge together and they're organizing their work in this neighborhood, you don't need so much around it. So you don't need management. You don't need a lot of back office activities. So we say, okay, you should see these little teams from 8 to 12 persons as an organization. And then you can save a lot of costs to spend them on the nursing part. So we have only 25 people in the head office for 6,500 nurses. So a lot of things can be automized. All this administration can be automized. You don't need people for that. So, and then you should, as an organization in healthcare, you should focus on the healthcare and the nursing. So I think most important is use your skills as a nurse to handle this complexity and make it simple.
So what's next for you? What action steps do you see yourself taking into the future?
In Holland, we try to also use this model for other fields in healthcare. So we also started with youth care and with psychiatric home care. And we try to build another infrastructure. We want to start with small-scale living in the neighborhood so that people can stay in their neighborhood. So 8 apartments together, supported by a Buurtzorg team. And I think if you also descale to a neighborhood scale, and you use the networks in the neighborhood, and people can keep on using their networks, they can lead a normal life as long as possible. So what I try to show is that you can use it in every field of healthcare, so working together with hospitals, for example, and with family doctors. We want to create neighborhood clinics together with doctors, family doctors, and hospitals. So that's for the coming 5 years. We're also supporting schools, because you also see that the schools, the educational system, has the same problems as the healthcare system. And we want to find out if different countries, for 3 years we have a lot of contacts with Japan. We started in Sweden, and I hope we will be able to start within a few months in Minnesota. And my idea is we should create this global nursing network. These healthcare problems in all these countries are quite the same. And the perspective of the nurses on these problems are also quite the same. If I talk with Japanese nurses, of course they talk Japanese. But even when it's not translated, I usually have the feeling that I understand what they're saying. And then the translation comes afterwards. But what I want to show is that this thinking about nursing is universal. So you can, in every country, this is the same motives, the same intrinsic motivation of nurses to want to do their work as good as possible. And I think we can learn a lot of these different histories, the different cultures, the different circumstances in these countries. And then I think as nurses, we should show the system what's the most effective way to deal with these problems, and not the system should follow us instead that we should follow the system. That's what I would try to achieve.
Great contributions. So what a wonderful combination, your background in economics and your values and your understanding, your innovation, your leadership, your influence, and your respect and appreciation for social networks. It's worked pretty well for you. So, good.
Thank you.
Okay, your turn. So, Rochester, St. Cloud, this is a 1-2-4 question generation. And so this is how it works. I'd like for you each to think silently to yourself, reflect, what question would you really like to ask Jos? What's most pressing on your mind? What curiosity do you want satisfied in regards to that? And I'll give you about, maybe 35, 40 seconds or a minute to do that. And then I'd like for you to engage with another person, a dyad, a two, and share your questions and find out what's similar and what's different about those questions. And I'll give you maybe 3 to 5 minutes to do that. And then the two will come together with a 4, and we'll sort of see what the iteration of the pattern of questions is in regards to that. And then we'll take some of those questions from Rochester. If you can email them to Fabiana, I think she's on the chat line, or St. Cloud. Maybe she'll be our conduit here in regards to that. And And then we'll take questions from the audience, and you can pose those questions to Jos, and we'll continue the interview. So, ready, set, go. I have to go get my stopwatch.